University Hospitals of Morecambe NHS Foundation Trust and Humber NHS Foundation Trust put themselves at the forefront of healthcare innovation by implementing Lorenzo. Here, the trusts tell of their experience of being an early adopter of an electronic patient record system tailored to the NHS.
The key drivers have been numerous in terms of patient safety, ensuring that we have a computerised record of patient care.
Very challenging time in the NHS. We really need a system that we knew we could develop with.
We work in such a large area and patients will have access to, in some cases, 3 or 4 different services. So having information that's reliable, timely, electronically available to staff is absolutely key.
We found it extremely difficult to get paper information to the point of patient care. Certainly in the advent of patient choice, our patients were choosing to move around in Morecambe.
Over the last 10 years, healthcare has become so fast, furious, multi-site, multi-departmental, that actually the paper records just no longer can keep up.
The more accurate and contemporaneous data that we have about a patient can only result in better patient safety and improvements in patient management and patient flow.
If we're having contact with the patient, we're getting better information that's joined together for clinical decision making.
When an assessment is done, it's only done the once and people can add to it, so we get an accurate picture of the needs of that patient and their carer.
We managed waiting lists manually. We had 2 systems that we had to work from. The duplication of inputting was immense.
With the ability to work in a mobile way, supported by technology, and not having to return to the office on a regular basis to make entries into clinical notes, etc., will provide efficiencies as part of our ongoing quick delivery.
You can actually show patients information on the screen. You can graph things like blood tests and show them, so it makes more sense when you can actually show them.
We communicate far more effectively now with our GP colleagues. The fact that we can get a very rich, clinically rich document to a GP within 24 hours after discharge means that crucial handover of care is done very, very effectively.
We have now got improved data in the emergency department, we've got improved coding, we've got great communication with the GPs. Our inpatient colleagues are getting much better data in terms of what's been happening in A&E.
Certainly the visibility of what's actually going on in the organisation as a business has definitely been a huge benefit that Lorenzo has given us.
I had directors of information asking why would you do it? And my question back is, why wouldn't you?
At the end of the day, the team needs to have information as quickly as they possibly can to make decisions. So having that information at our fingertips is fantastic.
I think the key success for the delivery of the Lorenzo product has been the way that the team, and I don't just mean the Humber team in that, I mean the wider team of partners, actually worked together to actually implement a system that was always targeted at being very clearly about improving clinical care.
Lorenzo is a highly credible solution as a core theme to establishing electronic records.
Lorenzo is an integrated EPR platform, and as such it offers a significant capability not just to clinicians but admin staff as well.
It's made life easier, I think. We don't have as many people being turned away.
It brings everybody together around the single most important person in that clinical setting, the patient.
We have been converted. I think that we are at the start of a really good journey with this system. The only way to really be convinced of that, I think, is to come and look at it and see it in action. It's worth it.